This is Blood and Cancer, the official podcast of MDedge Hematology/Oncology, where we discuss the latest research, treatment considerations, and other issues related to hematology and oncology.
Hi, everyone, and welcome to our podcast. I'm Dr. Alan Lyss, and I am honored to serve as your guest host this week on behalf of your regular host, my colleague, Dr. David Henry. This week, we're going to be talking about Drive-By FluFIT. FIT, of course, stands for Fecal Immunochemical Test, and Drive-By FluFIT was a colorectal cancer screening program that was implemented during the pandemic. It was the subject of a terrific presentation at the American Association of Cancer Research's special conference on COVID and cancer recently. And here to tell us about Drive-By FluFIT is the best possible person, Armenta Washington, who presented the results at the AACR conference. Armenta is a research coordinator at the Abramson Cancer Center, Perelman School of Medicine at the University of Pennsylvania in Philadelphia, where I trained, by the way. And at Penn, she's also involved in Penn's Office of Diversity and Outreach, helping to build community partnerships with medically underserved communities, including engaging the underserved in clinical research, which is really a vital endeavor and a really heavy lift. Armenta, it's really great to have you with us here today. I wondered if you could start out by giving our listeners a brief overview of what the original FluFIT program is and why it began.
Hi, Dr. Lyss. On behalf of myself and Dr. Carmen Guerra, the director, and my colleagues at Enon Tabernacle Baptist Church and Einstein Healthcare Network, I thank you so very much for this opportunity this afternoon. And yes, I'd just like to let you know that this was a best practice of the American Cancer Society. The program was designed to increase colorectal cancer screening amongst adults and to provide healthcare providers an opportunity to promote this amongst their patients at the time of their annual flu vaccine. And so studies showed that providing a home screening kit with instructions and a return envelope increased colorectal cancer screening. So what the Abramson Cancer Center did was combine the best practices of the American Cancer Society's FluFIT and implemented the NCI Screen to Save Colorectal Cancer screening to develop a campaign using the socially distanced Drive-By FluFIT.
Okay, very, very good. And what have the results of FluFIT been so far, just in general? Has it proven feasible? Has it increased screening rates for colorectal cancer?
Absolutely. So as I was telling you, we just actually were in the field this past Saturday. And so because we were just in the field on Saturday, we all had to rest up on Sunday. We don't have the results of that as of yet. But prior to Saturday, 335 people had actually registered. And so what we know from that, the 192 participants who actually received the FIT, 154 of those individuals actually returned the kit. And of those 154 who returned their kits, we know that 141 had a negative FIT result and 13 had a positive FIT. And so to date, we're actually still working with the individuals that had a positive, navigating them back to their primary care physicians. Some of them have since had colonoscopies, some of the results we know, but that's still in process.
Very, very good. And why specifically did you decide to do the Drive-By FluFIT program during the pandemic? What led you to do that?
So what research was showing is that at the height of the pandemic, 90% of individuals were not showing up for both colon screening as well as mammograms. So there had been a 90% decrease. And how we decided to do this was inspired by the death of Chadwick Boseman. We had actually been working on addressing this within the healthcare system, but when Chadwick Boseman died from metastatic colorectal cancer in August, Reverend Leroy Miles was concerned about the risk of the general public and wanted to address this disparity within the African American community. And so we know also from research that African Americans are 40% more likely to die from colorectal cancer. And, this is one of the most preventable cancers. And so that's why we decided to do it this way.
Got it. Very, very good. And I know that Dr. Sharpless at the NCI has predicted that because of the drop-off that you described in screening rates during the pandemic, we may be facing 10,000 additional cases of advanced breast and colon cancer 10 years from now. So it seems like it's a very worthwhile endeavor. I know you've been involved since the very beginning. Can you describe a little bit of the logistics and what the steps were involved in arranging By FluFIT?
Absolutely. So Enon Tabernacle Baptist Church, which is one of the largest Baptist churches in the Philadelphia region, had been employing a drive-by model to engage the community. They were using it to distribute food. They were providing an array of health services. Excuse me. Enon had been using a drive-by model to engage the community to distribute food, to provide an array of health screenings, which included one of the first COVID-19 screening sites in Philadelphia for the African American community. So Enon Tabernacle Baptist Church decided to reach out to Abramson Cancer Center and leverage the relationship with Abramson as well as the Einstein Healthcare Network. They reached out to Chi Eta Phi, which is a Black nursing sorority, and the City of Philadelphia's health department, and leveraged all of us collectively in this project. So, as I said, Enon had been engaging well over 14,000 individuals back in the fall. And what they decided to do was to use their online registration process, which is how members of their congregation, as well as members of the community, were actually registering to participate in any of the events that they were holding. And so they, in turn, used the screen to save questionnaire and placed that on their website. So once an individual went on to register, they went in, it took them straight into the REDCap. And so that is where they completed a 14-item knowledge questionnaire with true, false, or multiple choice items on a response scale. And participants watched a 7-minute screen to save colorectal cancer screening educational video, which was posted on YouTube. And that was recorded by Dr. Michael Goldberg at Einstein Healthcare Network. And then there were 5 intention item questionnaires that had a 5-point Likert response scale ranging from strongly agree to strongly disagree. And so once the individuals were actually registered, they had the option of choosing which of the 3 drive-by FluFITs that they would attend. And so once they actually were registered, the event took place in the parking lot of Enon Tabernacle Baptist Church. So participants came in their cars. They remained in their cars while physicians in PPE provided instructions on how to use the FIT, how to return the completed test to a medical collection box at Enon Tabernacle Baptist Church, which sits in their vestibule. So all the person has to do when they return it is drive up, get out, and just stick it right back in that collection box. The doctors also answered any of their questions. And if they wanted to, they could stay where they were, and a nurse would walk up and then provide them with the flu vaccine, and then they could drive off.
Got it. Very, very good. You've mentioned, Armenta, a little bit about the results of your first screening barrage. You said, if I'm not mistaken, there were 335 people who registered and 192 who participated, and it generated 154 tests that you had to analyze. But can you kind of drill down a little bit on what you learned from the entire endeavor? You mentioned all the tests you did and all the surveys. What did you really learn from the project?
I think one of the biggest takeaways from this for me individually was, we know that there were some limitations because we we don't know as of yet what the results of the colonoscopies are, and some of those are still pending. But this research does show that a socially distant drive-by FluFIT program is feasible, it's acceptable, and it's an effective way to engage the community. People were very, very thankful to us for actually providing this opportunity to them. The educational component is very important. And then again, it's just an effective way for people to be screened during a pandemic. And we also learned that this is a program that could help mitigate the significant decline in colorectal cancer screening that has occurred as a result of the COVID-19 pandemic. And it helps to reduce the burden of colorectal cancer in these diverse communities. And so at least we can address, we're not able to, right now we have some limitations in that we're not able to serve the entire city, but we're taking this from one community to the next. And we're doing
Got it.
that.
Got it. It struck me that you had 13 positive tests, and you mentioned that you're in the process of finding out how many of those people may actually have colorectal cancer, if any do. But I know you also did the knowledge and intention testing of the patients. 13 out of 154 tests returned is really a pretty high number of positive tests. So it seems like you did a pretty good job screening people who actually were at high risk for having a positive test. What did you learn from the knowledge and intention score testing that you did, and what did you make of all of that?
So the individuals, we know that as a result of the knowledge and intention scores, again, they were pretty good at baseline because this was, many of these individuals had either, had some college or were college graduates. So we take that into consideration. But for the most part, the baseline knowledge about colorectal cancer was high, with the exception of 4 items. That was one related to risk factors for colorectal cancer, the frequency of FIT, the Lynch syndrome. Many people weren't aware of that, and the relationship between physical activity and the risk for colorectal cancer. We also found that after viewing the video, all knowledge scores increased except for one item related to the earlier discovery of colorectal cancer and its relationship to survival. And all baseline intentions to discuss colorectal cancer and screening were high. After viewing the video, scores increased somewhat. They increased slightly.
That's really good. That must have made you feel good about the educational programs that you provided to them.
Mm-hmm.
Yeah. Let me ask you, you just mentioned that you had your second drive-by FluFIT program this past weekend. You had some no-shows at the time of your original programs. You had some people who picked up the FluFIT kit but didn't return it. Did you learn anything from that original experience that kind of guided you a little bit this time and made you do things maybe a little differently? Or?
Yes. So for the no-shows, where possible, special arrangements were made with a number of those who had not returned their kits. So we have gone as far as to leave them with the security guard at the church. We have even gone to their homes and left them in their mailboxes. We've been engaging the participants by phone calls, text messages, emails. Some who did not return their kits, once we actually were able to reach them by phone, had shared with us that they've since followed up with their PCP, and that some people are in the process of being scheduled for colonoscopies if needed.
Very, very good. It sounds like you've already done another drive-by FluFIT program this past weekend, but what do you see as your next steps with this project? Are there next steps that you've already got in mind?
What we hope to be able to do is, Enon Tabernacle Baptist Church is located in the northwest section of Philadelphia, but we see there's a high incidence of colorectal cancer in Southwest, and West Philadelphia. And so we are going to be expanding our services into those communities. We hope to include other screening, such as screenings for diabetes, hypertension, HIV, take-home tests. We also want to adopt this model and at some point evaluate the feasibility of a drive-by COVID-19 vaccine and fit once the priority groups are in alignment with what they're recommending locally from the health department. So those are some of the things we'd like to implement going forward.
That's fabulous. You know, it occurred to me that Enon Tabernacle Baptist Church must have a lot of credibility. And it seems that they were responsible in to some degree for your great success with this program. One would sure think that COVID vaccination at Enon would also be very helpful.
Right. So right now, Enon is serving as a vaccine site for Einstein Healthcare Network. So probably as we speak, people are being vaccinated. They have been also continuing to do the COVID testing. They are absolutely a trusted partner in the community. They call themselves Sweden in that they will work with just about anybody. They actually come across the aisle to work with all different types of faith-based institutions that are serving the community, all types of organizations. And Reverend Leroy Miles did share that at this point, they're probably engaging well over 30,000 individuals through the work that they've been doing through the pandemic.
Very
So their
good.
numbers have more than doubled.
You've addressed this a little bit, but I remember feeling just very impressed with your presentation at the AACR meeting. And after today's podcast, I could imagine that somebody listening to this podcast would want to implement a FluFIT program at their own center. Do you have any lessons, any things that you learned from conducting the program, things that you would advise people considering doing this to watch out for, or things they should pay particular attention to?
Yeah, absolutely. One of the things that we often forget that sometimes people forget we're in the middle of a pandemic. We're a year in, like literally this is a year. And so we have to consider that in this year that there are a number of hardships that individuals are faced with. And many individuals have lost their employment. Many of them have lost their health insurance. And so they're scrambling to try to just figure out how to make it from day to day. And oftentimes in those types of situations, they put their health on the back burner in trying to manage their children being educated from home and any number of issues. And so this just is one thing that helps to address. It's just one decision that they don't have to make in all of the other things they're trying to juggle. The navigation again is key to this in helping just individuals where needed to, help them through this process, especially for an individual who may have lost their job for the first time in like 20 years. They don't really know how to navigate the waters of going into the like our city health department, and then having the relationship not just with the nurses and the administrators of the health department, but also just being the liaison between the two, between the patient and the system, to help them to navigate that, or either a federally qualified health center. The key is linking with a trusted community partner. So as far as the credibility is concerned, Enon is very, very trusted throughout this city. And so once they push something out, it's like once they give their stamp of approval, you can just almost guarantee. Once Reverend Waller says, makes the announcement, most people absolutely will participate. Another thing that I think people really have appreciated is the fact that they're not only engaging with staff, but with faculty that look like them. So when they see an African-American doctor walk up to their car, and the person that looks like them is actually, caring for them and answering their questions. And, a lot of people have a lot of reservations about getting colonoscopies, so when the doctor looks like them, can reassure them of everything, it's like they really respect and will honor what is being asked of them. And then I guess the last thing is to consider a central location that can accommodate the vehicles, because there's a lot of traffic that comes with this. And so you want to be respectful of the neighborhoods that you're in, that you're not like bottlenecking the traffic, but you want to make sure that you have the footprint to be able to pull this off, as well as to provide opportunities for those who don't drive. So making sure that it's accessible by public transportation, or that it's a place that people can walk up and to pick up, because we do have people that actually also walk up.
You verified a lot of what I thought was likely to be the case when one really got into the weeds of how to conduct such a program. I think you mentioned that something like 15% of your patients were uninsured, and you had to navigate even some of those patients through the maze of getting colonoscopy performed. People would call for colonoscopy and be put off for 3 or 4 months, and you had to intervene at that point. And I see you nodding that that's correct.
Absolutely. So there were several, but the two that really stick out for me, both lost their insurance as a result of the pandemic. One, her husband was a member of a local union, lost his job, therefore they lost their insurance. She needed to be navigated through a federally qualified health center, and she needed to be navigated onto specialty care. Second person works for a local university. They made some cuts. She was one of those individuals. Again, she lost her insurance. And so I had to help those individuals to the point of just like weekly, sometimes twice a week, talking to them and helping them to get connected into the services, and making sure that they actually got what they need. So one of those individuals has been seen. She actually had her colonoscopy, and as a result, they found polyps. The polyps were removed and they were non-cancerous, and so she's good. She also, in doing this, she actually came just to get a flu shot. She had no intention of even participating in this FIT test. She just happened to drive up and see that this was going on, and she was like, well, why not? What the heck? And then once she took the test and found out that she was positive, and then once she was navigated into the specialty care, after some really thinking back, she realized that she also had a family history. So this was very important for her to do. And I had the pleasure of actually meeting her last week. So
Really?
Yeah.
Oh, fabulous. Thank you so much for putting a personal face on your presentation with the discussion of those two patients. It really helps a lot, because I think all of us can relate. And Armenta, I want to thank you and congratulate you on your group's accomplishments for conducting the By FluFIT program. It was really a tremendous amount of work. It seems like you've been involved in every facet, from concept design to implementation to patient navigation and now data analysis.
Yes.
So you've been there from the beginning and through to the end.
We have lots of moving parts to this.
Well, congratulations with your success on the program thus far. And I also want to tell you what a thrill it is for me to host a podcast on which a clinical research coordinator is the featured guest, because clinical research associates and research nurses are vital to all cancer clinical investigators during their professional lives. They certainly were to me. And without you all, cancer research is a frustrating and flawed endeavor. So thanks for what you do.
I thank you so much for that, and I appreciate that.
And thank you for speaking with our listeners today. You've been listening to the Blood and Cancer Podcast. For those of you who are new to our podcast, you should know that bullet points of the notes from today's show will appear on the webpage mdedge.com/hematology-oncology when the podcast airs. And I have to tell you, they're a really terrific summary for tumor boards or for whenever you're trying to summarize what we discussed today. I'm Dr. Alan Lyss. I hope you found today's podcast useful, and I hope you'll take the opportunity to join us again next week. Thanks for listening.
Blood and Cancer is produced by MDedge. Our editor is Jen Smith. All MDedge podcasts are produced by Executive Editor Kathy Skarbeck, and I'm your host, Dr. David Henry.